Thank you very much, Carly. Heart Month is an international effort to raise awareness for conditions that affect hearts of all sizes. And Dr. Silverman joins us with tips on how to keep your child's heart healthy. Dr. Silverman, so good to have you back.
We're back in studio. We're back here live.
Yes, so good to have you. I'm excited. You look so nice today.
Well, thank you, as do you.
Thank you. You know, we've been talking about this all month long, and we always cover the adults, but it's time to talk about our kids. As a parent, I know that there's some things that I need to look out for, just like every other parent. What are some signs that parents can look for and things parents can do that can lead to earlier intervention and better outcomes for their kids and teens?
Well, I can tell you this, that the most important thing is knowing your family's history, because a lot of stuff that happens in children really happens genetically. There's a lot of different types of diseases that children get that are not sort of translated into adults. That is, they don't generally get heart attacks, but they do get irregular heartbeats, and sometimes that's genetic. They do get valvular abnormalities, where there's a heart valve that is either too leaky or not developed appropriately. They can get chest pain, but it's generally not coronary artery disease. It's generally something else, and so that they can also get hypertension. And so understand the risk factors and understand that your kid has to be out there outside playing, being healthy, doing the same things that we tell about adults, but also to know that your pediatrician or whoever the healthcare provider is has to check for some of these.
I know that for the children that play sports, which are a lot of children,
right.
I've heard from a lot of my mommy friends and parents that a lot of their children, they feel like they're going to faint, and sometimes is that connected to a heart disease?
Generally not. Generally, that's kind of overwork or something. I know I do a lot of generally physicals. I'm involved in amateur boxing here in town, and so we do a lot of physicals for kids. And there's certain things that we look for, especially types of murmurs that we're looking for. Sometimes the kids come in and they do have hypertension, and so we say, look, you can't box today. You've got to go see somebody, so that you do have to worry about hypertension in certain types of individuals.
And we want our kids to stay healthy, so of course keep them active, make sure they eat healthy,
right.
Not active just one day a week, several times a week.
Several times a week, right.
Do it as a family.
Right, and also understand that starting the types of habits that lead to heart health on the long term start as a child, and your child will mimic what it is that you eat. And so have those types of things out there. We all have been talking about what it is. It's heart healthy diets, lean meats, lots of fish, fresh vegetables, those types of things that we all know about. Give those to your kids as well.
Dr. Silverman, always good to have you. Now back
great to be
studio,
back. We're back. We're back. We brought the band back together.
That's right. Thank you so much for being with us this morning. If you have a question for Dr. Silverman, all you have to do is text it to the number on your screen, 361-855-6397.